Are you struggling to close deals? Cold outreach is wasting the time of both the buyer and seller at every stage, especially when sellers are using shallow and outdated data. Your organization can overcome these challenges with technology that translates comprehensive, high-quality buyer data into real-time insights. These deeper insights empower sales reps and teams to adopt the habits of top performers, which leads to better outcomes, like more pipeline, higher win rates, and larger deals. We call this deep sales. And we've built the first deep sales platform with the next generation of LinkedIn Sales Navigator. Right now, you can try LinkedIn Sales Navigator and get a 60-day free trial at linkedin.com/trial. That's linkedin.com/trial for a 60-day free trial. Let LinkedIn Sales Navigator help you sell like a superstar today. Just go to linkedin.com/trial and get started.
Audible's Best of 2024 picks are here. Discover the year's top audiobooks, podcasts, and originals in all your favorite genres. From memoirs and sci-fi to mysteries and thrillers, Audible's curated list in every category is the best way to hear 2024's best in audio entertainment. Like a stunning new full-cast production of George Orwell's 1984. Heartfelt memoirs like Supreme Court Justice Ketanji Brown Jackson's Lovely One. The year's best fiction like The Women by Kristen Hanna. And Percival Everett's brilliantly subversive James. Audible. There's more to imagine when you listen. Go to audible.com/imagine and discover all the year's best waiting for you.
Wish TV's Focus on Food is a commitment to improving food accessibility in the community. Hear from expert culinary contributors, health professionals, and people who are making a difference in the fight to eradicate hunger. Made possible by Indiana University Health.
A new citywide initiative is bringing local area business executives, various city leaders, and neighborhood associations together with IU Health in order to launch a new nonprofit.
The Indy Health District Inc. is the nonprofit, and its mission is to create healthier communities in 5 neighborhoods near IU Health's new downtown hospital. Here to take a deeper dive into what this means for area residents is Executive Director of Indy Health District, Jamal Smith. Welcome, Jamal. Thanks for being here. We appreciate it.
Thanks for having me. I appreciate it.
All right, well, let's talk about this. So what programs or what neighborhoods rather are we talking about, and how did you choose which neighborhoods you were going to have be a part of it?
Yeah, absolutely. Great question. So the Indy Health District is made up of 5 historic neighborhoods. You have Meridian Highlands, Highland Vicinity, Crown Hill neighborhoods, Ransom Place, and the historic Flanner House Homes. They all make up the Indy Health District. It all came by way of the new IU Health Medical Campus that's being built. If you've driven anywhere near 16th Street, you see that. And the idea is that, for example, if the new medical campus was the proverbial pebble that you dropped in the pond, how far out would those ripples go before something began to push back? And we figured out that Meridian was a pretty hard push on the east border. The Indy Health District goes as far as 36th Street. The socioeconomics shift quite drastically as you get past 38th Street. And then MLK became a western border, doglegs west around the creek, and nestles just south of the new medical campus around St. Clair Street. So within that footprint are the 5 historic neighborhoods, and we're excited to support. They've been very, very supportive of the effort, and candidly, they've led a lot of the energy around what should be focused on when it comes to the Indy Health District.
The vision, though, has been considered a little bit lofty. Why is that?
Well, a good chunk of what we are aiming to accomplish has never been done. Now, pockets of it have been, and also the sheer size of it. So it's over 1,500 acres, which by way of an innovation district is one of the largest you'll find in the country. Also, too, it's a matter of comprehension. Most innovation districts have a specific focus, whether it be innovation-specific research. Some are education districts. Some might focus purely on housing and affordable housing. The Indy Health District focuses on all of those things. So you have housing, childcare, the need for green spaces and trails and pocket parks. Education is a big focus. So too is workforce development and housing and all of the things that include housing. So affordable housing, that middle market housing, as well as market rate. We're trying to make sure that mix is legitimate and everything in between. So yes, so food and access to healthy food, which I'm sure we're going to transition to here in a minute, is obviously one of the focuses of the health district as well.
You just highlighted those key socioeconomic disparities that these communities encounter. Can you elaborate a little bit more? I know we talked about access to healthy foods.
Yeah, absolutely. So if you currently live within the footprint of the health district, census data says you are scheduled to die roughly 20 years prior to folks who live just, let's say, 8 miles north of you in Hamilton County, for example. And that has more to do with social and environmental factors than it does even your access to the hospital itself. So all of those things that we just mentioned, all of those social impediments, social determinants to health, are the things that contribute to that discrepancy in life expectancy, right? And so the Indy Health District is designed to address all of those things in collaboration and partnership with those 5 neighborhoods that I mentioned, and then the supporting anchors that have helped to stand up the health district, including IU Health, Citizens Energy, the IU School of Medicine, the Children's Museum, and IB Tech are all the supporting anchors.
This obviously isn't an overnight fix. These have been problems in these communities for many, many years. How do you guys mark the success of this? Because it's got to be done incrementally.
Yeah, loaded question, but a very, very good one. A couple things to reference. You're right in that the issues that we are outlining aren't new. In fact, they are decades and sometimes centuries in the making. And so the fix to them, or the solution, if you will, isn't going to happen overnight. The way that we're tracking success, the North Star is that life expectancy. So we're looking to address that life expectancy, understanding that needle is not going to move overnight, right? But we want to make sure that we do it in a sincere and genuine fashion. We can move a bunch of affluent people in here who have all the resources in the world and then claim that we've addressed the life expectancy piece, but that would be disingenuous, right? We want to make sure that we invest in the neighborhoods as they are, in the people who have been living, working, and playing and praying in that space for quite some time, and then track that. So we know that even though that life expectancy needle may not move quickly, there are other inputs that will impact it. So we understand that there's a need for housing. So as more housing comes online, how do we track how the availability and the affordability of housing begins to impact one's life expectancy? Childcare is another one. How do we make sure that we are removing the need for folks to make life-altering decisions as to whether to buy food or pay for child care, and how does that impact mental health and therefore life expectancy? How do we improve the education attainment and allotment and access to a quality education within the health district? How does that then, eventually, change that life expectancy? So we're partnering with the IU School of Fairbanks School of Public Health to help us track the metrics and create that dashboard so that we are, one, transparent about the progress that we're making, but also we keep ourselves accountable for the efforts that we're embarking on.
Well, those are some huge efforts. Thank you so much, Jamal, for being here and taking the time out. We're going to have all the information on our website. We really do appreciate you.
Absolutely. Appreciate you guys.
This is the Wish TV Focus on Food podcast, made possible by Indiana University Health. Find more on the Focus on Food website by visiting wishtv.com/food and watch the ongoing coverage on Wish TV.